Hello and welcome. I am Dr. Karen DeSalvo, and I lead the team that serves as the backbone of health expertise across Google. We guide the company as it develops products, makes discoveries, and provides services that help improve the health of everyone. We focus on privacy and equity by design, and we drive the highest industry rigor in the work. I'm glad you can join us today at our second annual Google Health event, The Checkup. Before we get into the program, though, I do want to take a moment to acknowledge that there is a lot going on in the world right now, and many people are affected, professionally and personally. Against the backdrop of a global pandemic, we're witnessing a geopolitical crisis with the invasion of Ukraine. My heart is with everyone impacted. I'm proud to work at Google, where we continue to show up and be helpful in times of acute need and crisis. Our work to improve health doesn't stop during a crisis. After all, people will be diagnosed with cancer today, and others will have a heart attack tomorrow. So thank you for taking time to tune in so that we can show you what is giving us hope for the future. Today, we're pleased to share some of the amazing work happening at Google Health, all towards achieving our vision of billions of healthier people. I joined Google just about 2 years ago, inspired by that very vision and the opportunity to achieve it. I spent 20 years practicing medicine, and in my work, I carry the stories and lessons my patients taught me at the bedside and in the clinic. I learned early that building trust is job one. As my patients trusted me more, I could help them more on their health journey. I also learned that my patients had health drivers beyond medical care, including their zip code and the color of their skin. I'm excited to be at Google, where we understand the importance of putting people first and not just building better health care, but helping people build healthier lives. COVID-19 stepped onto the world stage less than 30 days after I joined Google. At the time, most people had never heard of flattening the curve, social distancing, or mRNA vaccines. But they did know they could turn to Google for help. In response, our whole company pulled together to provide answers when people needed them most. One of the many ways we did this was to amplify the important messages from public health authorities by donating Google search advertising and offering expert assistance to ensure their messages were effective as possible. Through one of these initiatives, the World Health Organization was able to serve more than 2 billion public service announcements, lifting up authoritative COVID-19 information. The reach still astounds me. Today, we find ourselves entering a third year of the pandemic, and I'm inspired by the resilience I've witnessed. And I'm hopeful for 2022 as we return to a new normal. For Google, the pandemic strengthened our resolve that we could and should work to help everyone, everywhere, live a healthier life. The pandemic underscored that the right information at the right time can save lives. We learned that Google can be most helpful when we meet people where they are through tools they already use like search and YouTube. And finally, the pandemic reminded us about the power of partnership. We want to be a trusted partner for 3 key groups. First, we want to help people be healthier in their daily lives. With information and insights, whether they're patients or not, these are our consumers. Second, we also partner with their caregivers, providing tools and technology to offer the highest quality, most accurate care. And by caregivers, we mean all the professionals and institutions who help you on your health journey. And lastly, since we know that being healthy is impacted by where we live, learn, work, and play, we also partner to support healthier communities. Consumers, caregivers, and communities, our 3 Cs. Today, we're going to take a closer look at how we're bringing Google's tools and technology to support the 3 Cs. First, let's start with consumers. Billions of healthier lives means helping everyone everywhere in their personal health journey as they seek to discover, understand, decide, and act. Today, you'll hear from my colleagues, Dr. Garth Graham from YouTube and Hema Buddharaji from Search, about ways that we're supporting that journey, whether that is helping people view authoritative, culturally relevant health information on YouTube or finding a local doctor who takes their insurance and speaks their language on search. We'll also share how wearables and other sensing devices offer personalized insights that can motivate us to be healthier. For example, last year we launched new features to sleep habits in the Nest Hub. And just over a year ago, we welcomed Fitbit, a team that trailblazed a new category for health and well-being. Coming up, I'll introduce Fitbit founder James Park to share updates on new features supporting heart health. The second of our 3 C's is caregivers. We focus on supporting them and applying Google's expertise in organizing information through cloud solutions and products like Care Studio, as well as through technologies like AI. Last week, Care Studio announced a partnership with Meditech, our first EHR partner. With this exciting progress, we hope to show how our tools can give clinicians the information they need to care for patients all in one place. Today, Dr. Charles DeSalvo from my team will lead a discussion on the partnership. At Google I/O in 2021, we shared research we're doing with Northwestern, where we're applying AI to mammograms to help screen patients for breast cancer. This year, we partnered with this work with several trusts at the UK National Health Service, exploring how AI can help radiologists prioritize higher risk patients. The goal is to get the right diagnosis as fast as possible by using AI to support radiologists. And in so doing, we reduce waiting times and cost. When I think about the potential that can come out of this research, I'm reminded of all of my patients who anxiously waited weeks to get mammogram results. We're also partnering to study how AI can assist pathologists in the diagnosis and determination of treatment options for prostate cancer and other cancers. For example, we're working with the U.S. Defense Innovation Unit to explore the use of augmented reality microscopes that can bring AI directly into the pathologist's workflow. The goal is to improve diagnostic accuracy and efficiency for treatment of cancers. Today, you'll hear from my colleague, Yossi Mateus, from research about some of the ways we're using AI in health. We'll also hear from Ivan Puparev of our Advanced Technologies and Projects team, who will give us a preview of early research aimed at improving how people recover after surgery. The final category in our 3 C's, community. We know that health is driven by more than healthcare, so we have to support healthy communities. We help people find resources like healthy food, greens, and we're looking at the impact of climate on health. Building tools for some of the population isn't good enough. We cannot leave anyone behind. That requires us to build tools that are helpful in any community, anywhere. You'll hear from Googler Catherine Chow and from Garrett Mell, our partner from the WHO, about new open source software initiative. Together, we aim to help developers build interoperable and secure applications for community health workers serving patients in low and middle income countries. We'll also give you an early look at something else we're working on, gender equity. We believe technology can close gaps, including how women of color and those from underserved communities access and experience healthcare services like maternal health. We'll hear from Googler Dr. Ivor Horn, who will introduce an equity-focused research initiative that we're kicking off. She will also share a conversation with Dr. Lachey Ajayi at Scripps about the Fitbit-funded Power Mom study. So lots to cover as we share our work to partner with consumers, caregivers, and communities. So now, without further ado, I'm delighted to welcome my colleague, James Park, to get us started.
Hello everyone, I'm James Park, co-founder of Fitbit. I joined Google just a little over a year ago, and it's great to be here today to share more about how Fitbit continues to help people on their health and wellness journeys. More than 15 years ago, we created Fitbit with a vision to help make everyone in the world healthier. Since then, we pioneered a new category of wearable technology that makes health more accessible, fun, and achievable. We do this through our devices and services, and by working with health plans and employers to make health more accessible and affordable for everyone. We know that being healthy is far more than just activity. It's about holistic health and how it all fits together. For example, tracking nutrition, helping with a better night's sleep, or managing stress. Our Fitbit platform makes managing overall health fun and motivating. Behind our wearables are many technological innovations that continue to push the limits of what wearable sensors can do to make the invisible visible. For instance, Fitbit was one of the first to support continuous wrist-based heart rate tracking. We're also one of the first to bring sleep tracking to wearable devices with a multifaceted view that included measuring stages of sleep and offering insights on sleep quality. We were the first to bring an electrodermal activity, or EDA sensor, to wearables, measuring hand perspiration to measure how your body is responding to stress. We've also made metrics like oxygen saturation, skin temperature, and breathing rate more accessible, putting users effortlessly in control of their health and wellness. Among the areas where we believe wearables can have the most impact is heart health. Heart rate is a foundational metric for general health and well-being, and it's also been a core offering for Fitbit users from the early days. PPG optical sensors are able to measure the tiny fluctuations of blood that happen under the skin with each heartbeat. We use these sensors in our wearables to measure blood volume changes to track heart rate and variability during a workout or while sleeping. In recent years, with an increased focus on supporting chronic conditions, we tested and launched our first FDA-cleared ECG, or electrocardiogram, app that allows people to assess their heart rhythm for signs of atrial fibrillation, or AFib, a heart condition that affects nearly 33.5 million people globally. AFib can be difficult to detect outside a hospital or clinic, as episodes can be sporadic and asymptomatic. Some studies suggest that as many as 25% of people who have an AFib-related stroke find out they have AFib only after a stroke has occurred. Because it can be so hard to detect, being able to more continuously look for signs of AFib is essential, including at night when the body is at rest. That's why in 2020, we launched the Fitbit Heart Study, a clinical study directed by doctors at Harvard involving nearly 500,000 Fitbit users to test our PPG AFib algorithm, which looks at heart rate data passively and can alert users to sign of any irregular heart rhythm. The study results presented at the most recent American Heart Association meeting showed the algorithm accurately identified undiagnosed AFib 98% of the time. We've submitted our algorithm to the FDA for review. This is one of the many ways we're continuing to make health even more accessible to more people around the world. Next up, we'll hear from Hema Budaraju on how search is expanding your access to the right information at the right time and simplifying actions like finding available doctors and locking in appointments.
Hi everyone, I'm Hema and I lead our health work on Google Search. No matter where we live in the world or how old or young we are, one thing holds true for all of us. Health is a universal need. Today, when we have questions about our health, the internet is usually where we start our journey. That's why, no matter what you're searching for on Google, it's our mission to give you relevant and authoritative information exactly when you need it. COVID-19 has shown how important it is to access timely health information from trusted national and local health authorities. Billions of people from more than 200 countries in dozens of languages have accessed information about COVID on Google. That's why we continue to expand our search experience, including things like news, statistics, trends of the pandemic, and information on how to access testing and vaccines to protect yourselves and your loved ones. COVID testing remains a critical need for all of us. On Google Search and Maps, you can easily find details on tens of thousands of testing sites worldwide. In addition, vaccines are one of the most important tools to fight COVID. That's why we worked with dozens of partners to highlight over 180,000 vaccination sites across the globe. If you're in the US, a quick Google search will show you where to find different types of COVID vaccines and boosters nearby. Or It can show locations that have vaccines specifically for kids. We also launched a feature in the US to show vaccine appointment availability to make it easier to find a nearby location. Beyond the immediate challenges of COVID-19, we are working to make healthcare more accessible to everyone. There can be a lot of friction when you're making a doctor's appointment. In the US, the average wait time for a primary care appointment can be 20 days or more. It shouldn't be this hard to get access to care. We are really excited to announce that in the coming weeks, we'll make it easier to find healthcare appointments by showing available dates for local providers on Google Search. Maybe, like many of us during the pandemic, you've recently moved and you're looking for a new doctor. Or maybe you've put off getting your annual physical checkup. Or maybe your child needs a same-day visit. Our broader efforts are focused on how to help you get care with less friction. We started by showing you which doctors accept your insurance. And now we are expanding access to available appointments as a next step to help you stay safe and healthy. We are just getting started with a few early partners, and we are excited about making your health journey easier. Now, I'd like you to introduce to my colleague, Dr. Garth Graham, to tell you about what we are doing with high-quality health information on YouTube.
I'm so pleased to be here with you. I've spent the majority of my career focused on the social determinants of health across many different parts of the healthcare industry, government and academia. Now, you may be thinking, that's great, Garth, but what does YouTube have to do with health? And how is a video site supposed to deliver better care to patients? It connects directly back to the determinants of health and the things that drive health outcomes. There are reams of literature looking at the impacts of housing policy, food insecurity, and racial equity on health outcomes. But there's another area that we need to start focusing on, and that is information as a determinant of health. As anyone who's worked in public health knows, empowering communities with education is essential to helping people live healthier lives. This has been brought into even clearer view over the past 2 years as the world has battled a misinformation epidemic alongside the COVID pandemic. We need to consider where and how people access information about their health, the quality of that health information, how easy it is to understand, and how engaging it is. Listen, the reality is the majority of healthcare decisions are made outside the doctor's office, in the everyday life of our patients. As physicians, we only have limited opportunities to connect with people within that exam room. And how can we better show up at many more points within a patient's day, bringing health information into their lives through the spaces they already visit? YouTube is already a part of a patient's journey. When they turn to us for answers to their health questions or look for a community who understands what they're experiencing or find helpful videos to explain complicated medical information more easily, health education can come in many forms, and we've just seen firsthand how powerful video can be used as a medium to reach people with health messages. That's why the mission for YouTube Health is to provide equitable access to highly authoritative health information that is evidence-based and culturally relevant as well as engaging. This approach also further reinforces our ongoing efforts to tackle the very serious issue of medical misinformation. We want to make sure that people are finding information from evidence-based authoritative sources, and that information is easy to understand and connects with them in a personal, engaging way. We're doing this with a focus on two key areas: information quality and information equity. First, let's talk about quality. In the past year, we've launched new features, kicked off new partnerships, and worked with experts in the field to help build foundations upon which we can greatly scale our work in health in 2022. We continue to expand our work with leading health organizations like Mass General Brigham and public health leaders like the American Public Health Association, as well as with clinicians and creators. Our goal is to further increase the accessibility of high-quality health content on our platform. Listen, These organizations are creating engaging, evidence-based videos that really connect with people. In addition to increasing the volume of highly authoritative content on YouTube, we're working to increase the way people find it and raise up its discoverability to ensure people can find these sources easily when they come to YouTube. To do that, we've added health source information panels on videos to provide context to help viewers identify videos from authoritative sources. And we've also introduced health content shelves that highlight videos from these sources when you search for specific important health topics on YouTube. These context cues aim to help people more easily navigate and evaluate credible health information. Starting just this week, users in Brazil, India, and Japan will also see these new features while searching on YouTube for top health conditions. As part of this effort, we partnered with the World Health Organization and the National Academy of Medicine on principles for evaluating authoritative health sources. We've also worked closely with regional health authorities while doing this. We're excited these features are rolling out to more people and plan to reach additional communities across the globe later this year. The second key I mentioned that we're focused on is information equity. If we all agree information is a determinant of health, meaning that it drives healthcare decisions, then we must consider how that information gets to people. Health leaders have a responsibility to keep pace with the changes in where and how people find information. We must meet people where they are and connect with them in ways that are not only scientifically accurate, but also culturally relevant and engaging. Through video, we can provide free and equitable access to the best and brightest thinking in science and medicine, and we can make it engaging, interesting, and compelling to watch. We can become part of people's lives and reach them in the moments that matter. More and more leaders are taking up that challenge. I'd like to share a couple of examples with you guys. The first is the New England Journal of Medicine. As many of you already know, the New England Journal of Medicine is not only recognized for publishing practice-changing medical research, but it's also become a cornerstone in providing equitable access to information for many years by allowing online access to readers in the world's least developed countries. New England Journal of Medicine has just taken a new step forward in providing access to the best minds in medicine by launching a new channel on YouTube. They're creating short summaries of key findings from their latest articles, along with interviews and animations to provide the best and newest medical research from the journal and make it available at no additional cost to audiences around the world. YouTube Health also has experts making the most of digital video to support public health education efforts. The American Academy of Pediatrics has used YouTube creatively to reach younger audience. One particular project, they created short-form videos called YouTube Shorts to connect with young women, girls, and gender-expansive people about key topics related to their health, such as menstruation and consent. The AAP has launched a video series to empower parents with the information they need to make decisions about their child's immunizations. The videos cover a commonly asked question, but also address how disinformation and misinformation about vaccines can spread online and help parents know how to find accurate information. Lastly, the American College of Physicians has also tackled vaccine misinformation, but from the perspective of the physician. Their physician-to-physician conversation series teaches doctors the effective communication strategies to build vaccine confidence and address patient concerns that are rooted in misinformation. All of these are great examples of how medical experts are reimagining how and where health information is shared to increase access to information for everyone. It's really an exciting time to be working in health communication. We have more tools available to help people than ever before. The scale and reach of platforms like YouTube can radically increase equity of access to high-quality health information by breaking down barriers between the ivory towers of academia and the everyday people who want to understand how to take better care of themselves and their families. There's always more work to be done, and we hope to make a difference through our focus on information quality and equity. Of course, the whole world still needs better access to healthcare. Yossi Mateus is here to talk about how we're using technology to expand access and the important role your smartphone will play in things like screening and affordable care.
Hello, I'm Yossi, and I lead the Health AI team. along with other teams who are advancing AI and using AI for the benefit of society, including conversational AI and tackling the climate crisis. Our teams focus on impact-driven research, innovation, and moonshots. So here's what we know. Healthcare is not equally accessible across the globe, whether due to cost, proximity to experts, schedule flexibility, or a host of other factors. So when we think of making healthcare more accessible to everyone, people like Santi come to mind. Santi lives with diabetes in rural India. She's been diagnosed with diabetic retinopathy, a disease that can cause blindness if not treated early. Diabetic retinopathy is asymptomatic in its early stages, making screening critical for diabetic patients. Unfortunately, challenges in access to healthcare means getting a diagnosis could take months if she's diagnosed at all. Santi is not alone. Diabetes affects 400 million people across the globe, 70 million in India alone. With the help of new technology and expanded access to healthcare, diagnosis of diabetic retinopathy and other diseases could be vastly improved. In fact, it's already happening. Santi could get same-day screening and treatment because of these advancements, instead of waiting for months. Over the past few years, we've shared progress on our work in this space. Last year, we shared updates on our automated retinal disease assessment project in Thailand and India, also referred to as ARDA. ARDA uses AI to help detect diabetic retinopathy in patients like Santi. This is done by developing machine learning model to look for signs of diabetic retinopathy in photographs of the back of the eye. For patients, it's a simple process of sitting in front of a tabletop camera that takes the picture. The clinician then asks ARDA for an interpretation and uses the information to decide whether to refer the patient to an eye specialist. We're so excited to share that this project has been tested with the Thailand National Screening Program in a prospective study, which found that ARDA can be deployed safely and in real time across multiple regions and achieves comparable accuracy to eye specialists. Across the globe, ARDA has screened more than 75,000 people, the majority of whom, including Santi, live in remote and rural parts of South India, with 10 times lower access to eye doctors than in urban areas. This innovation marks great progress. Our work with ARDA has reinforced the need for regular eye screening, especially for those who live with diabetes. But it's also made clear that we need to reach people who are unable to get to a clinic. So we've been reimagining the entire patient journey and investigating what's possible at home. Our engineers and scientists are envisioning a future where people, with the help of their doctors, could detect, diagnose health conditions from their own home. Today, our research uses large tabletop cameras to make high-resolution photos of the outside of the eye under uniform lighting. We found that a machine learning model could sometimes detect when a patient has high blood sugar levels, high blood cholesterol levels, or diabetic retinopathy on the inside of the eye just from these photos. This research has recently been published. We're in the early stages with our academic and non-academic partners such as IPAX and CGMH, and hope to build on this promising proof of concept research. This includes further exploration to see if smartphone images could also be used to detect these and other potential health issues. With over 4 billion smartphone users globally, there is an enormous opportunity to increase the accessibility of screening and affordability of care. A device that was once used solely to make phone calls or sending texts has transformed to a fully featured computer with many sensors and functions that have the potential to unlock accessibility. One way we're doing this is with Dermacyst, our AI-powered skin condition search app that helps people better understand their skin concerns by answering a few questions and taking 3 quick photos. Importantly, this technology comes with the responsibility to build a product that works for everyone. People of all skin tones, skin types, ages, genders, and more. We have been working hard to build Dermacyst with health equity as our priority, and we're excited to get Dermacyst in the hands of product testers later this year. As with Dermacyst, growing from solid-based is something we're already working through on other projects. Last year, my colleague Shweta Patel introduced some of Google's work to extend the usefulness of everyday sensors to support daily health and well-being. At the time, he shared a new feature in Google Fit that uses your smartphone camera to measure your heart and respiratory rate to track fitness goals. I'm delighted to share that these features, which were first available on Google Pixel, are now available on more than 100 Android device models, as well as iOS. Outside of the camera, a smartphone has many features and sensors that may give insights into health or wellness. Another capability we're testing is whether a smartphone's microphone can correctly record the sounds that a person's heart makes when placed over the chest, just like a stethoscope would. Listening to the heart and lungs with the stethoscope, auscultation is a critical part of the physical exam during a doctor's visit. Healthy hearts give a characteristic rhythm, lub-dub, lub-dub sound. But hearts with valve diseases, like aortic stenosis or other conditions, can make different sounds such as whooshing or rubbing. Heart valve disease can sometimes go undetected. A study from the Journal of Cardiology found that 40% of patients are not diagnosed with aortic stenosis or AS until they start to show symptoms. A different study from the journal Circulation found that by the time AS patients show symptoms, half are already too sick, so sick that they will die from the disease within 2 to 3 years. Screening for AS typically requires specialized equipment, like a stethoscope or an ultrasound, and an in-person assessment. We're currently in the early stages of a clinical study where we're testing whether a smartphone application that uses the phone's built-in microphones can record a participant's heart sounds when placed over the chest. We look forward to sharing more on that in the future. Remember something? ARDA helped ensure her diabetic retinopathy was detected early enough to possibly save her vision. For future patients, we hope to bring Santi's access to care closer to home with no commute needed. Google Health strives to build more affordable, convenient, and accessible care to people around the world. We can't wait to share all of these groundbreaking developments in the technology with you. Next, we'll show you what Google's Advanced Technology and Projects team is working on with UCSF researchers. Together, they're using AI and affordable consumer electronics to monitor knee replacement recovery and create a future where surgery recovery can be continually and accurately measured outside of medical labs.
My name is Jack Sims. I was a high school art teacher, moved to the desert, built a studio. My midlife crisis sports car is this. First sort of documented damage to my knee was in middle school, and I developed the disease of the growing end of the bone. So that, coupled with just being very active in sports, my left knee started acting up. By my early 60s, it was becoming a problem where some days it was hard to walk around without limping on it. When I went to the orthopedic surgeon and they talked about knee replacements, I was actually thrilled that there was a possible way of fixing it once and for all and alleviate it.
There are approximately 1 million knee replacement surgery procedures performed in this country every year. It's predicted that 50% of adults will have advanced knee arthritis requiring knee arthroplasty at some point in their lifetime, and that number of total joint replacements performed in this country will grow to almost 3.5 million over the next decade. While total knee replacement is considered one of the most successful procedures done, there are some challenges that we still need to solve. One is that somewhere between 10 and 20% of patients still have problems after surgery. But we have a hard time measuring those outcomes. We have subjective measures, how patients feel, and then we have traditionally seen patients in the clinic. But that's twice, sometimes 3 times after surgery over the course of a year. What we've never had before is the ability to track how people do over time on a continuous basis.
My recovery was longer than other people's recovery. I didn't really feel like I had a partner in that.
We really want to be studying those people who are at risk for having a poor outcome. The UCSF Human Performance Center can evaluate patients. We can reserve the resources like the 3D gait biomechanics lab for those individuals that most need it. However, access to that is quite limited. Generally, only people who enroll in research studies get to experience 3D biomechanics testing. So our standard equipment in our laboratory is motion capture data. We put markers on specific areas on people's body, and then as they walk within the laboratory, the cameras can track those markers. We create a 3D model which tells us exactly where the joint locations are. Measuring these key variables in the laboratory is great. However, it's not enough. What we really need to know is what people are doing in the real world.
We're not the first. Looking at the opportunity to use sensors to recreate a gait lab-like experience where we can start tracking how people do, but not have them come back into an academic environment or lab environment to do so. I actually had the opportunity to attend TED, and Ivan was showcasing how the Google Jacquard sensor could be used to interface with their environment. I went to Ivan to mention that I've been doing this research, and I've been very disappointed with the results of using commercially available wearable sensors to track patients in the gait lab. And he said, there's a reason for that. You're simply collecting the wrong data, but we can help you with that.
My first reaction was, we can do so much more with modern artificial intelligence techniques and machine learning techniques. Solving problems, such as the one we're working on with Dr. Bini, requires to have a broad variety of perspectives and broad variety of expertise. And I'm leading an innovation group at the Advanced Technology and Projects division in Google, also known as ATAP. Our team is highly interdisciplinary. We have hardware engineers, we have signal processing experts, we have machine learning experts, and we have interaction designers. And by working together, we can approach this problem holistically. The modern methods of artificial intelligence, particularly in real-time and on-device machine intelligence, which allows to run very complex machine learning models which understand human emotions on very inexpensive and very easily accessible computing hardware, such as the one we're using in a Google Tag. Tag is a small computing module which is designed to go anywhere where you want to put computing in.
So the goal of this early R&D project is to see if we can replicate the results of the Git lab using the Google Tags. If we can do this, this means that we can replicate the same type of analysis in the lab outside in the real world. So one of the big technical challenges here is how can we replicate the output of the UCSF GitLab analysis system with the Google Tag? So to achieve that, we use our custom neural network architecture. This allows us to take our raw time series data and actually be able to estimate directly from this in blue what the knee angular velocity could be.
What the AI team at ATAP was able to do is match our 3D biomechanics data to within 1 degree throughout the entire gait profile. I didn't really think that was going to be possible.
One of the key things that we've learned is that the single sensor alone, we are able to accurately replicate the output for some key variables like knee angular velocity.
If we are successful, these techniques will have massive impact on how people recover after complex operations, particularly with orthopedic environment.
This idea of collecting data real time, 24/7 during recovery phase, and using that information to improve the recovery process, we're on the cusp of a revolution about how we think about patient care.
Hi, my name is Dr. Charles DeShazer. I'm an internist by training and the Director of Clinical Products at Google. Patients rely on their doctors, nurses, and other healthcare professionals to make well-informed decisions about their care. But oftentimes, the information caregivers need isn't easy to access. It may be buried deep in the patient record or spread across IT systems that don't speak to each other. And that's why doctors often don't know your full medical history or may be unaware of the care you're receiving elsewhere. This is why you may need to repeat your history when you see a new doctor, even in the same system. So fragmented data impacts everyone, the patients, the nurses and doctors delivering care, and more. Improving on the flow of data across healthcare systems, referred to as interoperability, is key to ensuring optimal patient experience and outcomes. Last week, we announced a new partnership with Meditech to take a step forward in interoperability. This partnership aims to combine our data harmonization, search, and summarization capabilities from Google Health's Care Studio product suite and integrate them into the Meditech Expanse electronic medical record system. So let's dig in. I'm here with Ashima Gupta, Director of Healthcare Solutions at Google Cloud, Mike Cordero, Director of Interoperability and Strategy at Meditech, and Ian Brown, a licensed RN for 13 years and now a clinical implementation specialist at Google Health. Let's start by grounding in the importance of interoperability in terms of patient outcomes. Ian, can you talk through some of the challenges you faced in delivering optimal patient care when data is fragmented?
Sure. Previously, I worked at a pediatric hospital that didn't have an emergency department, but we were connected to an adult hospital that did. So kids that came in through the ED and got admitted to our unit, we couldn't access any of the data that was from the ED because they were on a separate EHR. And it was a frustrating experience for the providers and also the patients who were asked the same questions upon admission that they were in the ED just down the hall. And in the ICU, I took care of a lot of chronically ill patients. And I remember one young boy in particular that came in. He was admitted on night shift. His mom was at the bedside and he was chronically ill. So he'd been in and out of the hospital a lot. And his mom had a binder at the bedside. And she opened to a specific page and she wanted to let us know that her son was taking a certain medication because her son's doctors had told her to always make sure every care team knew about this med. And it was important because it was a steroid, which you never want to stop taking abruptly. And the moment gave me pause because I felt really conflicted. As a nurse, I thought, this woman is incredible. She has all the information that I need. But as a mom, I just thought, this is the middle of the night. She's exhausted. Her son's in the ICU. But she's so accustomed to this lack of communication among healthcare organizations that she took it upon herself to make this binder and bring it with her to every facility that she goes to, and to be here in the middle of the night just to ensure her son has continuity of care. And I just couldn't help but think, but that's not her burden to carry. And these are just a few examples of how the lack of interoperability impacts our patients, but unfortunately, it's far too common.
Thank you, Ian. That's a great example, and that is a burden that a mother in the middle of a crisis should not have to bear. Our Care Studio product is designed to provide a unified view of patient records, making them more accessible and useful for clinicians. Mike, what do you view as the top challenges in interoperability, and what are your hopes for this new partnership with Google Health?
Sure. So clinical information is often scattered across many care settings, stored in various forms, structured, semi-structured, unstructured. It's difficult for providers to review all the data formats in a quick and effective manner, especially when coming up from multiple systems and multiple locations. Clinicians need the information most relevant to the needs for their patient at their fingertips so they can provide timely, targeted care. So leveraging search summarization tools within Expanse will pull the information the provider needs into a clean summary without having to hunt for it and it builds on native streamlined workflows already available in Expanse. So I feel that the tools are complementary to each other.
Thank you, Mike. Something that's discussed frequently is how to prepare for increases in data loads. And many hospitals keep old applications running just to preserve the data. Ashima, can you speak to some of the trends, especially how tech like cloud AI are helping manage this influx of data and digital transformation trends underway?
Thank you, Charles. We've come a long way as an industry with digital transformation. And with moving to cloud and tools like AI, we are able to extract deep insight action from health system data. For example, cloud provides the ecosystem in two big ways. Number one, it's providing the secure encrypted data foundation to support data interoperability, to support the use cases that Ian mentioned. And the second is lowering the barrier for AI accessibility with technologies like cloud NLP to get meaning out of that unstructured data.
Thank you, Ashima. Mike, can you speak to the creation of Meditech Expanse and why it was important to have a native cloud solution?
Sure. So when Meditech designed Expanse, our goals was to create a modern mobile healthcare platform with an open ecosystem that embraced greater data liquidity. It also wanted to streamline data access from anywhere over the web and capitalize on cloud native technologies and tools like those provided by Google Health. And finally, a cloud solution simplifies the IT infrastructure for healthcare organizations. It provides much greater ease of scalability, improved security, and especially important in today's rapidly changing technology landscape.
Absolutely. I want to bring this back to patient care. For the Care Studio team, success will be when clinicians have a holistic and complete view of the patient record with ease at a glance. Ian, looking ahead, how will interoperability impact the everyday workflow of clinicians?
I think it's going to have a tremendous impact, saving us time, looking for information while we're at the bedside, reducing costs by avoiding repeat labs or procedures. In pediatrics, that's especially important because we're always trying to minimize the number of needle sticks that a patient needs. And taking it a step further, I think healthcare providers having a fully formed view of their patient's history makes healthcare more equitable across the board. It takes the burden off the patient and their families and helps ensure everyone gets the care that they need, independent of their ability to recall all the details of their medical history. They've got enough to worry about.
Absolutely. Thank you, Ian, and thank all of our panelists for joining the discussion. Next, learn how our partnership with the World Health Organization and Android developers is helping healthcare workers worldwide access and share information, empowering them to make more informed patient care decisions. Thank you.
I'm Catherine Chow, Director of Research and Innovations at Google. Mobile devices are essential to delivering data-driven healthcare, particularly in low and middle-income countries, or LMICs for short. Today, I'd like to share with you our work with the WHO and mobile developers to build an SDK, or a software development kit, that makes it easier to develop data-driven apps for community health workers. Community health workers often form the bedrock of healthcare in LMICs, where about half of the population lacks access to vital healthcare resources. These frontline workers who are embedded in the communities are the cornerstone to connecting patients with essential care. They take on jobs ranging from maternal and child health care to malaria prevention to helping families access health information. Over the past few years, smartphones and mobile apps have become invaluable care tools for community health workers. They support community outreach and home health services, including triaging patients by accessing immunization and care records, conducting health screenings, and distributing medications. Today, community health workers have these services at their fingertips, helping them deliver accurate and timely evidence-based care. These efforts aim to improve health outcomes at a population level across these countries. With these services come a new set of challenges. Often, community health workers will have multiple apps or even phones to manage the same patient across different disease or outreach programs. Incompatible data and lack of interoperability leads to situations where decisions for patients are made with incomplete information. We're applying technology to help accelerate a paradigm shift, where it's easier to develop healthcare apps that are seamlessly interoperable. By open sourcing and supporting tools that ensure the exchange of high-quality data, developers can focus resources on designing applications to meet the needs of their local communities without having to worry about managing clinical content and data requirements for evidence-based care. To advance this mission, we're collaborating with the WHO and an ecosystem of tech providers to create an open source SDK. This SDK will help developers build secure mobile solutions using a patient-centered global data standard called FHIR, also known as Fast Healthcare Interoperability Resources. This in turn makes it easier for health workers to deliver data-driven care. With over 3 billion active Android devices globally, there's an opportunity to support a huge number of health workers and their patients. Some health workers often need to deliver care in areas with unreliable connectivity. We've designed the SDK to allow Android apps to run offline with no connectivity by storing and processing data locally. The FHIR SDK is part of our mission to democratize access to high-quality care through mobile devices. Let me introduce a key partner in this work, Dr. Garrett Mell, Head of Digital Health and Innovation Unit at the World Health Organization. Thank you, Garrett, for joining us. Can you share a little more about the WHO's vision and how developers are using the SDK?
Hi, thanks so much for having me. I'm happy to share what we're doing at WHO to make things easier for developers. We want to bring evidence-based care to healthcare workers everywhere. First, we're helping our member states with care guidelines. These guidelines consist of life-saving interventions. Our approach applies to those already investing in digital transformation. Guidelines are designed to capture rigorously tested and adapted clinical and public health recommendations. Our goal is to provide an easier way to adopt high-quality, evidence-based care guidelines into digital systems. Now, translation, we know, has been a challenge. We need an accurate translation of narrative guideline recommendations into executable digital systems, and it's difficult. It's both resource-intensive and prone to mistakes. We have focused on updating guidelines for the digital era. We call these digitalized guidelines SMART because they're standards-based, machine-readable, adaptive, requirements-based, and testable. So we've embraced open standards like FHIR to support interoperability across patient-centered healthcare applications, and CQL for consistency in calculating decision support and indicators. It isn't yet easy to build software that can make use of digitized SMART guidelines. So to solve this, we've engaged the community and collaborated with Google on developing the FHIR Software Development Kit. We think this will make it easier to bootstrap healthcare applications with SMART guidelines, offline capabilities, and mobile-first functionality. Take, for example, WHO's MCare project. This is a project that's leveraging the FHIR SDK to develop a reference software platform. It's focused on healthcare for children in emergency settings. So when we combine SMART guidelines and the SDK, we enable technologists to accurately integrate evidence-based content and allow that interoperability. This is an open source and open standards approach that'll ensure every country's digital transformation has access and can leverage the latest care recommendations to deliver essential interventions to all.
Thank you, Garrett, for the insights into where we're headed. In addition to partnering with the WHO on accelerating the development of next-generation mobile-first tools for data-driven healthcare, we'd like to share some examples of other innovative tech collaborators who are currently doing amazing work using the FHIR SDK to help community health workers better connect with their patients. One example is ONA, a team working in Liberia building a FHIR-native health app for frontline workers doing health and humanitarian relief efforts. IPRD Solutions is a healthcare technology group that we partner with to enable health innovations. This partnership helped over 2,000 community health workers allocate malaria prevention nets to more than 700,000 people in Nigeria. And finally, Lattice Innovations, a health tech solutions company based in India, is joining the state of Tamil Nadu's Population Health Registry Consortium. They're building a community-led health screening and primary care mobile application that will help fulfill the state's vision to provide data-driven healthcare for all. We look forward to engaging with these and other regional app developers in our mission to empower community health workers and enable equitable access to high-quality care. We've spoken today about the remarkable partnerships and the incredible progress we've been able to make together. Next, you'll hear how we're working with Northwestern Medicine to put the power of performing ultrasounds in the hands of midwives to address maternal mortality rates.
I'm Dr. Ivor Horn, and I lead Google's health equity efforts. You've just heard about some amazing innovations in healthcare. But even with all these advancements, women around the globe still die during childbirth, and in high numbers. 300,000 maternal deaths and 2.5 million perinatal deaths occur each year, with an astounding 94% happening in lower and middle income countries. Uneven access to care can lead to unnecessary harm to birthing parents and their babies. Early ultrasound screening is a safe and effective method to plan for pregnancy care and identify issues early. The WHO recommends an ultrasound assessment before 24 weeks of pregnancy. This helps to assess the health of the birthing parent and baby, plan the pregnancy journey, and monitor for early risks and complications. Ultrasound technology is becoming more portable and more affordable. Yet, up to half of all birthing parents in developing countries are not screened at all while pregnant. Among the barriers to access is a shortage of expertise in reading ultrasounds. Our goal is to simplify barriers to acquiring and interpreting ultrasounds. How do we do that? By supporting more people like midwives and community health workers to provide care. Imagine anyone, anywhere, being able to perform accurate ultrasounds with just a small handheld probe and a smartphone. Throughout the past year, we've been researching the use of AI to assist with maternal health diagnostics. We will soon publish foundational, open access research that validates the use of AI to help providers conduct ultrasounds and perform assessments. Our hope is that this work and work to come will increase access to ultrasound and improve experiences for birthing parents and their babies. That's why we're working closely with Northwestern Medicine on further developing and testing these models to be more generalizable across different levels of experience and different technologies. We launched this partnership with the goal of cutting global maternal mortality rates in half. The goal, we aim to accelerate research and development in two key areas: identifying high-risk patients during pregnancy more quickly and reliably, and building tools to allow a broader range of professionals to confidently provide access to these assessments around the world. Together, this research can potentially drive automated and accurate AI evaluations of maternal and fetal health risk. It can also address barriers to scaling programs, enabling timely care in the right settings. To scale this technology and reach the many patients and providers globally, partnerships will be critical. We'll be working with healthcare organizations and local champions to develop novel technologies and get the technology into the right models of care to reach patients. We're thrilled to work with Northwestern Medicine on these early stages of development. Together, we're making continuous improvements toward increasing access to care for everyone, everywhere. Part of that is helping researchers with their work on maternal health. Dr. Lajay Ajayi is the Director of Diversity Initiatives and Clinical Researcher in Digital Medicine at Scripps Research, and you'll hear from her next. She's also an awardee of the Fitbit Health Equity Research Initiative, a program aimed at supporting researchers working to address health disparities. She's the principal investigator of PowerMom, a smartphone app-based research study that enables pregnant parents to share data about their pregnancies with scientists. This story is an important example of Google's efforts to make healthcare more equitable. Dr. Ajayi is focusing on how PowerMom can help underrepresented birthing parents who are more likely to die during and immediately after childbirth in the U.S. compared to their white counterparts. I am so excited for you to hear more about her incredible work.
When I was pregnant with my first daughter, I had terrible fibroids. They caused a lot of pain. As a Black woman, I actually avoid going to the emergency room because of the things that I face. I try to avoid it. In this particular instance, it was so bad that I didn't have a choice. I arrived by Uber by myself in excruciating pain. Nobody came to help me off her wheelchair. I was treated brusquely by the intake nurse. When I was getting my ultrasound, the technician was so rough and brutal, I was actually crying. And it wasn't until the person who was coming to check insurance realized that I was a physician within the healthcare system that the demeanor between the staff, the physician, everybody changed. The problem facing Black and Hispanic people, it falls into two really big categories. It's the lack of access, and then how we access the medical system in general. Black women are more than 3 times likely to die in childbirth or immediately after childbirth than their white counterparts. Black babies, again, more than 2 times more likely to die than their white counterparts. We're more likely to have gestational diabetes, preeclampsia, and die from those complications. But why is that? It's about Black and Hispanic women not feeling heard or seen with the medical system. It's important to me because it's healthcare, and it's something that we should all be able to access no matter what you look like. PowerMom First is a study from the PowerMom platform. It stands for Fighting Inequity and Racism Using Supportive Technology. We work with Fitbit to actually look at structural and systemic racism throughout the pregnancy journey. Do you mind if I touch your belly?
Absolutely.
Yeah. The goal of the study is that every person should have a healthy pregnancy and a healthy baby. The data that we'll be able to collect with Fitbit is 24/7 heart rate variability, oxygen saturation, body weight, sleep stage, and activity.
It looks like I've been averaging about 7 hours a night.
That's actually pretty good. And then we'll look at outcomes of your pregnancy. Were you someone who went into preterm labor? Did you have high blood pressure, hypertension, increased weight gain, whatever, during your pregnancy? That allows us to collect this objective data with the subjective information that they're providing to us. And it correlates with the questions that we ask them throughout the study. We ask them about everyday discrimination. We ask about vigilance. We ask about how they're perceived in their everyday lives. So are you able to find time to exercise at all?
You know, I've been doing better with that.
What I appreciate about Fitbit and this initiative is it allows me to give these devices to people who may not have access to it. It allows people who don't traditionally participate in research to give their voice, share their information so that we can be more informed. And by having a more diverse, informative database, you're actually able to break down health disparities. If you don't have representation in your cohorts, you can't have a representative treatment. PowerMom First and PowerMom is about everyday people working with researchers to find an answer, to find solutions. We can't fight systemic racism without the people who are experiencing it, without their input, without their feedback, without their information. And we as doctors, as researchers, want to work with this population. We want to make it easier, we want to hear you, and we want to make it better.
I want to thank Dr. Ajayi for sharing more about her personal story and her incredibly important work advancing equitable health research and more equitable health. Today, you've heard about our approach to partnering with consumers, their caregivers, and communities towards a vision of billions of healthier people. Together, we're building safe, effective, and trusted products that help everyone everywhere live a healthier life. To learn more about our work, please visit health.google. Thank you for joining us, and be well.